And welcome back to the medical report. If this is your first exposure to this topic, this is Dr. Robert Huxster, who is a hand surgeon from the Chester County Orthopaedic Group, discussing different disorders of the hand other than the trauma that we experience and what we do about them. So again, thank you for joining us for this discussion. One of the topics we're going to discuss is something called a trigger finger. So could you tell us what a trigger finger is?
Sure. The trigger finger is something that we experience as we get older. You don't see it very much in 20-year-olds, but later in years, 40s, 50s, and on up, it's a situation where a finger will catch. It often is a nighttime phenomenon, but it can occur any time during the day, where the finger will snap or lock and get stuck and then be hard to straighten back out again. And so it can, the triggering phenomena refers to going through that tight spot and then getting stuck, or going the other way, finally releases and comes back out straight again. It's a problem of the tendon that bends the fingers. It can occur in any finger. People sometimes think of it as trigger thumb because they're used to hearing of it in the thumb, but any finger can be involved. It is a little more common in certain situations. Diabetes, again, is one of those things that can predispose you to trigger finger. The problem is that the tendon that bends the finger, and there are actually two in your fingers, is binding or catching back at the entrance to the sheath or passageway that holds the tendon down to bone. So the tendon that bends your finger is attached to muscle up in your forearm and passes through your wrist, and just about here enters a passageway called the sheath. And that is where the triggering occurs, and it's also where the discomfort occurs. Some people, the trigger finger will be relatively painless, and some people, the trigger finger problem will be quite uncomfortable or painful. Some people really have only the pain and don't really have the catching or locking, so it can be a little bit of a spectrum. But typically the tenderness will be right there in the palm of whichever finger is involved, and it can often be multiple fingers involved.
We have a lot of golfers in this community here, and tennis players. Does this sort of thing contribute to trigger fingers? Is it traumatic or what? Probably
not. This is one of those things that we don't really know why people get it particularly, and it's not so much associated with activity as it is just an aging process, I think.
So it won't interfere with their putting or anything like that, I suppose.
Well, having it might interfere with putting. Okay. It certainly can interfere with your grip.
Okay. And so what do you do to correct this?
Well, some people will simply wear a splint in order to avoid having the finger pass through the catching spot. That's not a very practical solution, but in a painful situation it might be helpful. Again, you can use anti-inflammatory medications, sometimes can be helpful. In the office, when I see people with trigger finger, most of the time what I end up offering them in their first visit is an injection. It's a steroid delivered by injection into the tendon sheath, usually with some local anesthetic at the same time, can resolve this about 75% of the time. And when I say that, it really is referring to an injection or two or even three. So 3/4 of the time we can make the problem go away with an injection or two. The injection does hurt a little bit, but it works pretty quickly. It takes the pain away within a day typically. The triggering or locking usually takes a few days, a week to resolve. That means that there are 25% of people where an injection isn't going to help. So for that we do a surgery. The good news is that this is a very simple surgery. I usually do it under just local anesthesia. It's about a 1/2-inch incision over the tender spot. We numb up the area that we need to work, go down to that tendon sheath, and what we're going to do is simply open the sheath or split the sheath where the tendon is binding. The tendon has a bump or a nodule on it by the time it gets to the point of needing surgery that is hanging up, and by opening the sheath we can allow that nodule to pass through the tight spot without it being a problem. And that solves it. So I always think of this disease as a totally curable process. One way or another, I can make this problem go away.
Good. Does it happen in more than one finger?
Frequently.
Yeah.
I'd say more often than not, more than one finger is involved.
Okay. Now there's another disorder that called tendinitis, and we know most people are familiar with tendinitis in their shoulders and so forth. Could you tell us a little bit about the tendinitis in the hands?
Really, the example of trigger finger is a tendinitis, and so it's a inflammation of the tendon system. There are other tendinitises that are fairly common. In particular, a very common one is tendinitis along the border of the wrist here, and that will be often feel like there's discomfort or pain in the entire area, and sometimes it's hard for people to localize at first what they're experiencing, but they usually will begin to realize that it's somehow tied in with the thumb, and that's because the tendons involved are tendons that help you lift your thumb up. That's got its own fancy name. It's called de Quervain's disease or de Quervain's tendinitis, and that has the same treatment. It's just really the same problem as the trigger finger, but it's not in a flexor tendon. It can be treated with an injection, or if that fails to solve the problem, it can be treated with the same simple surgery.
Mm-hmm. Are these hand tendinitis problems as painful as the shoulder ones are?
Sometimes they are. I certainly have people that feel they're totally incapacitated on occasion by the tendinitis problem.
Mm-hmm. And sometimes the non-steroidals help that?
Yes, as we talked about with trigger finger, the tendinitis at the wrist can be treated with splinting, it can be treated with anti-inflammatory medication, it can be treated with icing. There could be a role for formal therapy for this tendinitis, the de Quervain's tendinitis, more commonly than trigger finger. We might try therapy. Modalities like ultrasound, for example, might help.
Mm-hmm. Okay, very good. Now, one of the other things that we get in our hands, and people aren't aware of it, but we get significant arthritis in our hands at times. So can you tell us a little bit about arthritis, where it most commonly occurs, and are there different types and so forth?
Certainly.
Yeah.
Just like other parts of the body, arthritis in the hand can occur from the more common, what we used to think of as wear and tear arthritis, known as osteoarthritis or degenerative joint disease. We now know that is also largely hereditary, so there's a strong family tendency to have that problem. There are other kinds of arthritis that can affect the hand too, rheumatoid arthritis and other similar related kinds of inflammatory arthritises. The treatment for these is just like in other parts of the body, primarily medical, at least to start off with. So medications to help control symptoms, and in the case of rheumatoid arthritis, the rheumatologist can sometimes slow down the process with some of the newer medications. With the more common osteoarthritis, we don't really have medications or ways to stop that disease. We're really treating symptoms. So Advil or prescription anti-inflammatories typically. Sometimes resting splints can be helpful. With the osteoarthritis, the joints involved typically will be the end joints of the fingers or the knuckles, and not so much the joints at the base of the fingers. Also early and often involved is a joint at the base of the thumb, and that's probably the one I see people coming and complaining about most commonly. Is, again, they're not exactly sure what's hurting them, but they're aware that something is bothering them when they go to open a jar or grip or pinch. They're having pain that stops their being able to do those things somewhere down here. And typically it's arthritis at the base of the thumb or between the base of the thumb and one of the small bones in your wrist called the carpal bones. That arthritis, we can treat those same ways that we talked about, but frequently that one also can be treated or ends up being treated surgically because it can be debilitating enough that it makes sense to do that. That's not so easy as some of these other surgeries we've been talking about. That's a little bit more like a total joint replacement kind of surgery in a hip or a knee, in the sense that we're making major changes. There are, in fact, total joint options, but in the hand they don't hold up very well. They're not very reliable. And most hand surgeons use a rather old technique to deal with arthritis in this joint of creating a interposition arthroplasty, of creating a spacer made out of your own soft tissues. So the surgery consists of removing some bone so that there is no joint anymore, just like with a total hip or a total knee, and then creating a spacer out of soft tissues, and there are a variety of ways of doing precisely that. It requires a long period of immobilization for that to work, though, so this surgery is a little different than the ones we mentioned earlier that have a quick back to normal function time frame. This one is casting for 6 weeks and another 6 or 8 weeks of recovery involving hand therapy in order to become pain-free again. But it is effective.
I'm sure many of our viewers have seen people with this very deforming rheumatoid arthritis of the hands, and particularly these proximal muscles or joints here. Is there anything you can do for those folks?
Rheumatoid arthritis is a little different. As you mentioned, it involves frequently these knuckles, much more so than the others. And there's a tendency for the fingers to shift or aim towards the little finger side. It's referred to as ulnar drift. So the fingers tend to slide that away. It's associated with changes in the way the tendons are working, as well as destruction of the joint. So earlier in the process of rheumatoid arthritis, there can be surgery, there can be splinting to control position at night. Resting splints can be quite helpful. Surgically, there can be correction of the soft tissue misalignment of these tendons and realigning of the fingers. And finally, there can be a joint replacement type of surgery. And in people who have rheumatoid arthritis who develop these severe deformities, because their ability to use their hands tends to be pretty limited in the first place, these artificial joint ideas or joint replacement modalities can have a role there, because they can hold up in someone who's going to have limited gripping and pinch force involved in the first place. So there is a role for some sort of an artificial joint in people with rheumatoid arthritis.
Well, this has been a terrific discussion, I think, for our viewers. I'm sure if we could get the phones ringing, we'd get a lot of questions. Is there anything that I haven't asked you today that you would like to share with our viewers that they might be of interest in?
I don't have anything else planned to bring to your attention. I think we've covered the basis for these more common complaints. Of course, there's lots and lots of more esoteric and puzzling problems that we run across that make life interesting every time I go to the office.
Well, I'm sure you're inundated with work, because orthopedic surgery is such a terrific field, and there's so many patients that have arthritis. We certainly appreciate your coming and visiting with us today, and I'm sure our viewers have enjoyed it very much. So thank you very much for joining us today. We hope you learned a lot more about the hand, and a lot more than just injury. So thank you for watching, and stay tuned to keep informed.